Hello, welcome back today. Today we're going to be talking about healthcare administration interviews. My name is Jeff Comer, and I've been a hospital CEO for over 20 years, and also have my education at the doctoral level in psychology with a focus on stress management. Now, I have maybe a bit of a unique perspective on this. I spent a big chunk of my career, and still do as a hospital CEO, doing interims, short-term turnaround assignments, either as a permanent or, as I mentioned, as an interim CEO. So, because of that, I have been interviewed hundreds, if not thousands of times. I don't even know how many times I've lost count, but I've been interviewed a lot. And on the flip side, I've interviewed a lot. So I've been on kind of both sides of the table and have that experience. Now, there are a lot of people that have written about how to interview, the technical aspect of how to prepare for it, how to research companies, how to come in and present your information, how to put your resume together, how to network, how to search LinkedIn, other social media sites. I'm not doing any of that. Okay, there's plenty of that out there. I am now a psychologist by background, and so I want to blend my psychology with my hospital CEO experience and talk about interviewing from a psychological standpoint. That's what I hope to talk about and convey today, and to give you some tips, again, from psychology on how you can make interviewing a little bit less stressful. So, first of all, let's talk about why interviewing is so stressful. First of all, interviews are just stressful, period. I mean, you don't need to be a PhD in psychology to state that, right? I know. But they are. They just, in and of themselves, they are stressful. You are putting yourself out there in an interview for people to criticize and discuss and review. They may have done Google searches on you. They've done background checks on you. They may have done reference checks on you. They've networked about you. They know a lot about you. So you're putting yourself out there. And if they don't hire you, it's kind of a rejection. I mean, that's psychologically how we take it. This fear of rejection can be really profound, and something that can really strike a nerve in us from an evolutionary psychological perspective, as well as just a daily practical psychological aspect. So it is very difficult to go through interviews. They are stressful. There's a fear of rejection. There's also practical fears. You're gonna have to resign from your current position. You're gonna have to sell your home, find a new home, move perhaps to a new city. You're uprooting your significant other, your kids, you're leaving other family members. You gotta move your dogs, everything has to go. You have to find new grocery stores and redo your insurance and health insurance. And there's just a lot to it. And all of this comes into that interview, because a lot of us are sitting in an interview thinking, gosh, do we really wanna go through all of this? Maybe I should just stay where I am right now. Some of us may have lost a job. We could have been part of a downsizing, a layoff. Maybe we were terminated for whatever reasons. That can factor into it as well. Additionally, sometimes you have to explain things in your history you're not so proud of. We've all got skeletons that we have to talk about at times, and that can be very stressful. So there's a lot of different things that go into being a stressful situation. And if you're like me, more of an introverted person, that throws a whole new level into this, because I don't like being in the spotlight. I don't like talking about myself. I would much rather ask people questions and listen to their responses and kind of take that in. I guess that's why I like psychology, and also as a hospital administrator, I usually would listen more in meetings instead of talking in meetings. So that's just kind of my personality. So an interview is actually an additional layer of stress for me. Finally, to a degree, there's an uncertainty and a loss of control in an interview. Now, as hospital administrators, we're typically more used to having more control. We set the agendas in our meetings, we kick off the conversation in meetings, we set strategy, we set vision, we do all these things that are dependent on us having a good sense of control and a good sense of certainty. An interview, you lose all of that. Now the interviewer is in control. They have the certainty. You don't really know sometimes who you're interviewing with, what their backgrounds are. So that can produce a lot of stress as well. So again, as I started out by saying, interviews are just stressful, period. That really summarizes it. But let's talk now about what we can do to psychologically reduce that stress. And first, I think quite importantly, you need to change your mindset about an interview. A lot of times we get the focus being on us, like I'm going to be interviewed. They are going to interview me. Folks, an interview is a two-way street. They are there to interview you. You are also there to interview them. You need to make sure this is a good psychological, cultural fit for you. You don't want to go into a situation where it is just not the value system that you want, or it's a strategic focus that doesn't align with what you want to do. It's very, very important that you understand the organizational culture and that you can feel a psychological comfort in joining that organization. If you don't have that, it could be a very short-termed situation. The other thing I was just kind of thinking, I remember one interview I went into was at a fairly large hospital, and I walked into the room, and it was a big, typical board table, kind of like in Christmas Vacation with Chevy Chase. Have you ever seen that when he walks in and his boss is sitting down at the opposite end of the room? If you've seen that movie, you know what I'm talking about. But I felt that. So I walked in, like this huge table and all these people sitting around it, and they had me sit at the front in the hot seat. And they kind of said, "Hi, how you doing?" And basically that was it. And then each person had this sheet of paper, and they just read a question. And I responded, they read it, and it just went on and on and on and on around the room. And at the end of all these questions, they did not give me a chance to ask questions or, talk to them or discuss anything with them. That was the end of the interview. And that was it for me. I was like, this is not a fit for me. Like, that's not how I do an interview. I'm looking for a cultural fit. So it is very important that you understand it's a two-way street. That can relieve some stress and pressure off of you right off the bat. They are being interviewed by you as much as you are being interviewed by them, okay? Second, understand the evolutionary psychological aspect of clan behavior. And you've heard me talk about this before, very related to the first question though. A clan is something that enabled humans to survive. Without a clan, from a historical evolutionary perspective, humans simply could not survive. We would die. That clan mentality, though, is still very much alive in our unconscious behaviors and schemas and how we look at the world, how we react to things, how we make decisions. And so you really are looking at joining a clan. So make sure that you understand the norms of the clan, of the organization, the culture of the organization. There's a bit of a fine line you have to walk in an interview, and it comes from the concept, the psychological and philosophical, sociological concept of individualism versus collectivism. What do I mean by that? So an individualistic society is a Western society. I'm being somewhat stereotypical now. The United States, for example, we're very individualistic. We are very based on, I can do this myself. I'm responsible for my life. You can't tell me what to do. I tell myself what to do. I set direction. Everything is on my shoulders. In an Eastern society, a collectivist society, more of a broad-natured, family-oriented culture where people make decisions for what is the good of the whole, not the individual. It's a whole different mindset. But when you're interviewing, you have to show yourself as an individual who can think, who can take action, make decisions, move in a certain direction. But you also have to blend with the collectivist mindset and model. And that can be difficult at times. So you have to kind of think through your answers and your responses from that aspect of being an individual, but one who can also fit into the group, the collective whole. Kind of tricky to walk that line at sometimes, and it's just something you need to think a little bit about. But again, you are looking to join a family, a clan, a structure, but you do also want to figure out how are you going to lead as a hospital administrator within that group structure. Third, there's always a fear of rejection. I talked about that earlier. They may pick someone else. They may not like you. You're putting your business experience, your educational experience, and your personality out there. In my opinion, when you show up to an interview, the technical skills are assumed. They already have passed you through that stage of scrutiny. They know you've got the technical skills to be an administrator or a CNO or a director of housekeeping or manager of the ICU, whatever your administrative role happens to be. Now they are looking for the personality. And there's always that adage that it's all about business, it's not personal. An interview actually is kind of personal, okay? Because they're looking for that fit, that relationship. Can they work with you? Do they like how you present yourself? Do they like how you communicate? Can you be a part of the team? Again, these things I'm talking about all kind of fit together. But I think that's something that you have to understand. There is a very valid fear of rejection. And it is kind of personal, so I'm not really helping you to feel better about this. I might be making it worse, but I think just acknowledging that you are aware of that there is some level of risk, which is one of the reasons an interview is so stressful, but it's not something that needs to hinder you. Now, fourth, and I guess possibly I would say most importantly, and this is kind of a complicated psychological recommendation I'm going to make, so to speak. But I want you to understand that you can take control of an interview by using some psychological concepts. These concepts are primacy and recency, confirmation bias, and reinforced conditioning. So what in the heck do I mean by all of that? Well, as you heard me talk about in the public speaking video I did recently, people in general don't remember what's in the middle. They remember the intro and they remember the conclusion. Now, a side note, a lot of people think that when people interview a host of candidates, that they remember the first candidate and the last candidate better. That is absolutely not correct. There's a lot of research on that, and the research I've seen, at least, that is not correct. They remember each candidate equally. So don't worry about going first, last, or being in the middle or any of that. But when you do interview, and this is important, they will remember how you present initially, that first impression, and they will remember how you conclude, the last impression. That is a very important concept. So I have a kind of a psychological technique that I like to use, and it's very effective, very valuable. So typically, when you're interviewing for a position this day and age, there may be hundreds of resumes they've received for your position. And a lot of times the interviewer is overworked, they're tired, they got a lot going on that day, and they just want to get through the interview. And a lot of times they're trying to screen you out. Now, I don't think any interviewer would consciously say, yeah, I want to screen him out. That's really not true. But most interviewers will typically go to your resume and say, well, you left this job pretty quickly. Why were you only there for a year? What happened at this one? Or there may be something on your resume that jumps out at them that they want to focus on. They're kind of going towards the negative almost. And human beings actually do have a tendency to go toward the negative. It actually is from an evolutionary psychological concept that you wanted your mind to focus on negative things because negative things from an evolutionary perspective could kill you. So we still actually do kind of gravitate towards the negative. That's a whole other video that I could do, very fascinating one, by the way. But that is something that does happen in interviews. They're looking at things in your resume they want you to explain. So here's my suggestion, taking control of primacy. When you sit down at the interview, you're going to have, hi, how you doing? How's the weather? All those kind of things. But before they get into the interview process, just say, and let's say it's a group of people that are interviewing. Say something like, folks, I really appreciate the opportunity to be here. I'm very excited to talk to you and learn more about the position. I'm really excited to talk about my background. Can you guys tell me why you found me interesting? What is it that made you want to bring me here to interview with you? Now think about that for a second. That is a very powerful statement you just made, but you did it in a very relaxed, informal, genuine way. But what did I do with that statement? Again, people typically go towards the negative. I've got them on the positive now. So I did a couple things. First of all, I took the spotlight off of me, gave myself a time to just kind of relax, compose myself. They now have to talk. And I made sure that they are focusing on the positive aspects of why they wanted me to come here. Instead of jumping right into, why did you leave this job so soon? And, tell me more about this. Now they're thinking in their mind psychologically about the positive reasons they liked my resume. So it starts them out positive. Now that leads into what's called confirmation bias. People confirm what they want to believe and what they think. So if the interviewers went into the interview thinking, I want to find out why he left this job. I want to find out, why did she go from this level and take a step down? They're already looking kind of on the negative side and they want to confirm that. Now they've told you the positives. So the rest of the interview is they start asking you questions. Use those positives. They just gave you a gift. They told you what they like about you. Now use that to your psychological advantage. When they ask you questions, bring it back to those positives. And now the confirmation bias goes to the pluses on your resume, the positives on your resume. And the more they hear these positives that they brought up, the more you reinforce it. It's reinforced conditioning. This is Psychology 101, classical and operant condition, Pavlovian responses, those types of things. You're now reinforcing the positive aspects of your candidacy. So you've just accomplished an awful lot with that one statement that you made. Now, at the conclusion of the interview, the recency effect restates your positives and how you can bring these positives to benefit their organization. Do you see what I did with that? That will eliminate a lot of your fears, your nervousness in an interview. Your rejection rate's going to go down. That bonding you're going to feel with people is going to go up because it brings an energy. Positivity brings energy. Energy brings relationships and likability. So the basics of Psychology 101 can dramatically help you in an interview. So think about what I just said with that final fourth and what I said to be the most important concept. Learn to use that. It can be very, very effective for you. There's nothing wrong with doing it. It's very genuine. It's very warm. And it really does all the things that I just talked about, can help you immensely in an interview, particularly in reducing your stress for an interview. As always, I hope this video was helpful. I've really enjoyed doing it. I appreciate the feedback that I'm getting from you guys. As you know, this is all brand new. I just started doing these videos and really excited to do it. I have a lot more that I want to do. Please leave comments, message me, tell me what videos you want to hear. Everything I do is with a psychological bent for hospital administrators. That's kind of my jam. So, think about things that you'd like to hear along those lines, and I'd love to hear from you. Thank you guys. Take care.